Hello there. We have Dr. Paré here, and he is going to be answering some questions from our Edge Fund supporters. How are you today, Dr. Paré?
Very good. Thank you yourself.
I'm wonderful. Thank you so much. So I guess we'll get started. A bunch of our supporters submitted some questions, and these were the top ones that were submitted. The first one is from Sylvia, and she wants to know, how long have you been a researcher?
So I've been faculty here at McMaster University for 11 years. But, before that, I've trained for 12 years at the University of Montreal, McGill, and also Harvard Medical School. So I guess, all in all, we can say that it's been 23 years, I guess. And, about half of it as a scientist in training and about the other half as an independent scientist.
Oh, wonderful. Okay, that's great. The next question is from Robin, and he wants to know, what is a typical day in a researcher's life like?
I mean, the first thing is that there are very few typical days because when we do research, it's always about pushing the boundaries and about finding new questions and new answers. So by definition, we'll never do the same project twice. We're trying to address questions, and whether the answer is positive or negative, then we see and we try to move on and to move to something else and newer. A typical day or week in my case, I will balance my time between patient care. So I do see patients in the outpatient clinic. Then certainly I will discuss with some of my students, and sometimes it would be a one-on-one type of discussion, or it could be a group or what we call a lab meeting. And then there's a lot of meetings with colleagues as well, and some of them is to discuss scientific questions or to establish collaborations, and other meetings are just more about the administration. There's also a little bit of teaching, and I think another important component as well is that in these days and age, science is not done by solitary people. Like nowadays, science is really much a collaborative, endeavor, and that means that we discuss and we work with and we help colleagues all over the world that have a similar interest, that are interested in solving the same problems as we do, but they come with a different point of view and a different expertise. So a lot of it is also to discuss with colleagues, both within Canada and outside Canada as well.
Okay, wonderful. The next question we have is from Victor, and he wants to know, what sparked your passion for heart disease research?
That's an interesting question. So I think what a lot of my work is centered around the genetics of cardiovascular and what we call molecular determinants, and really my passion started when I was training in Montreal and Quebec, as some of you might know. There's a founder effect for some genetic mutation that can lead to early cardiovascular disease. And I was really taken by this. And I said, well, this sounds pretty unfair to me. And it seems this is something that, we can do more about. And at least at that time, there just weren't a whole lot of, physicians that, would be knowledgeable about the genetics of this. And this is how I got interested in doing research. I said, well, I want to learn more about this because I want to treat these patients better. I want to give them better answers. And then when I started researching about this, then I found myself incredibly interested in pushing. And I said, well, there's so many questions that we still don't know. And you just realize how little we know. And I say, well, like we have to ask this question and that question. And I think, one thing led to another.
That's really powerful. Thank you so much. John has an interesting question. He wants to know, what is the biggest misconception about research?
There's a few ones I can think of. And one of them I've already mentioned is the fact that, science is done, by lonely people, and this is not the case anymore. These are huge collaboration, and some of our efforts, for example, to try to find new genes that are related to stroke, these are collaboration of dozens of research groups involving a total of like hundreds of people. Really needed. I think the other big misconception I find is to think that progress is made in big leaps. Okay.
Mhm.
And I think that in fact, progress is made in small steps. And there's a lot of people contributing to each of these steps. And, slowly we're kind of chipping away at this disease. It's really the accumulation of a lot of people contributing, having each their small contribution. But when you put all of this together, this is how we're making such progress in solving important health questions.
I love that. That's amazing. And that leads actually really well into my next question, which is from Rachel. And she wants to know, how does my donation make a difference at Heart and Stroke?
Okay. So, yeah, again, these are great questions. Each contribution makes a huge difference. And I have, many examples, but I think, the first thing is that, contributions help support research. Okay. And research, help us to improve on our understanding of disease or create, new tests and so forth. So one example from my own research group, we were looking for new ways to assess the genetic risk of cardiovascular disease. Most of the time, these individuals, they have very strong family history as well. And to me, as a geneticist, this is a very strong indication that, there must be something genetics going on. And, what we've hypothesized is that instead of looking at, one single mutation that explain it, what if it's the combination of many different, variation that each contribute? And this is what we call polygenic risk. And then, we've tested this hypothesis in patients with very early heart disease. And this research was supported by the Heart and Stroke Foundation of Canada. And we did find that actually about, 5 times more people with early cardiovascular disease had a very strong polygenic risk as compared to people with these mutations that, is what is currently done. So this research was, named as one of the top 10 advances in cardiovascular disease research by the American Heart Association. This is like, worldwide. And this is a kind of like a good step forward in, having a better investigation and genetic assessment of people with early heart disease. And this is entirely supported by the Heart and Stroke Foundation. Sometimes these advances, they lead, very directly to, change in patient treatment and improvement. And sometimes, like the benefit is a little bit more indirect because we understand a disease better. And, perhaps this will lead to the next project that will lead to that breakthrough that, we're waiting for. I think, it helps. So there's a lot of different ways that the Heart and Stroke Foundation, donation help. I think there's many examples of success in terms of research success, but I think, there's a lot of there's a lot of like successes that, they've trained very productive people that went on to great careers in cardiovascular disease. And I think that we don't talk enough about these ones because each grant from the Heart and Stroke can help train maybe 5 different people. And all these 5 people, then in their turn, they go on to their career and they do great things. So there's this domino effect here.
Wow, that's fantastic. Thank you. This is kind of a funny one from Anthony. What is your favorite part of your job?
you know, so I think, the favorite part of my job is when I discuss with students, and especially grad students, and like we have exciting new results and we're looking at them for, the first time. And then there's a lot of excitement and trepidation, highs and like looking at these results. And sometimes we've worked for years. Oftentimes we've literally worked for years to get to these final results. And we're finally going to get the answer to our question. And it's always exciting. And then, we can, share this with, students. And often we're surprised by the results, and that's great. So I think, this is the part that is, the most exciting. And it's fun for many different reasons. And there's the science as well, that's exciting, right? Because we ask a question and we work very hard to answer this question. So it's impossible not to be excited, when we, open these results and see what it is.
Oh, that does sound very exciting. um, and this last one, because this is a special chance for Edge Fund supporters to peek behind the curtain and see the face behind the breakthroughs. This is a funny question, but what is a random fact about yourself that you'd like to share?
Well, it's okay. Well, it's not an easy one. I would say that my hobby is trail running.
Oh,
And I think, here in Canada, we are blessed with a great environment and great nature, and I very much enjoy it.
nice.
And so I love to go in the woods and just run and have some fun. And I find it challenging and exciting.